Hey yo, it is Dr. Ijoma Nodim Opara here with your Fast 4. That is 4 health related facts delivered to you in less than 4 minutes. Today we're going to talk about advocacy. And so, what is advocacy? Advocacy involves promoting the interest or cause of someone or a group of people, including yourself. So, advocacy involves self advocacy, advocating on behalf of another person or an individual or on behalf of a larger system. It means being able to use your voice or help others use and also find their voice in order to speak up and speak out when you feel that a situation is happening that is not fair, where people are not receiving their fair treatment. And again, that includes yourself. So what can you do to advocate for yourself when you are in a healthcare setting and you're experiencing a situation where you don't think you're getting the quality care that you deserve? Number one, I always encourage people to have a very clear plan for their health. So writing down your questions and the goals that you have for that visit or that care experience, it's so important. And communicating that to your healthcare professional so that both of you can agree on what the outcomes of that visit needs to be. If again, you're not getting the quality of care that you deserve, then it is important to communicate that there is a gap between what your healthcare goals are and what is happening in that experience. It also helps to have somebody else in the room because sometimes, again, we have to be clear, there is a power dynamic, there's a power differential between patient and healthcare professional or healthcare provider, and having someone else in the room can help us be less nervous and more confident to speak up for ourselves. Also, that person can speak up on our behalf if we're not able to speak up for ourselves because we're feeling too sick or too uncomfortable or just not feeling equipped in order to that whereby we can communicate our needs at that time. So be very clear with your healthcare goals, have a plan for that visit and what the outcome should be. Communicate that with your healthcare professional and bring somebody with you, even if it is via FaceTime or again through the phone. It's helpful to have that present. Number 2, make use of institutions or organizations or healthcare facilities, patient care advocates. Most institutions, most hospitals, clinics, etc., they have a patient care advocate as part of their team. If again, you're not feeling that you're getting the care that you deserve or your loved one is not getting the care they deserve, you can absolutely ask for your patient care advocate. Related to that is knowing your patient bill of rights. Now this is a bill of rights that was fought for by grassroots organizations out of New York, Black and brown folks. Just a little history lesson, okay? The Young Lords. And they were able to establish what we now know as the Patient Bill of Rights. So you can ask to see that, and you can use that as a reference to, again, describe the fact that you're not getting the care that you feel you deserve and request a patient care advocate from that facility to help facilitate the situation and help you negotiate the care, again, that you deserve. Number 3, you are very welcome to escalate and ask for someone else if you're not getting the care that you deserve from the patient care advocate. And you can also use the compliance hotline of that facility. You can usually find that on their website. And 4th and finally, you are welcome to use patient care organizations that are committed to advocacy throughout the country and in your local environment. Organizations like the National Patient Advocate Foundation is a good place to start. Thank you for your attention and see you on the flip side.